Hi everyone, and welcome to another episode of Inspiring Careers. My name's Dan Johnson, and I'm here today with my guest, Dr. Blake Morrison. He's the head of Global Medical and Scientific Affairs for Halozyme, and he is the founder of the World Myeloma Forum. What are your top three success secrets that have helped you in your career? What's been kind of a driver behind that and getting to where you are today?
Yeah, three. Okay, so number one, it's interesting. We were having this conversation last night with another colleague. Taking risks. I think that I have in many successful ways and in some unsuccessful ways taken risks that I think stuck my neck out a little bit far, and it's worked out in most instances. I think you have to be a risk taker to really be that innovator and to be, really reach your full potential. Relationships, the relationships as in any industry and any role, we really function around relationships and successful nurturing relationships with both our colleagues internally within the companies, but also importantly external relationships with the thought leaders and our customers out in the institutions that we work with and interface with. So third, embracing the tools of the trade to the fullest extent. My business, World Myeloma Forum, it's a technology company more than it is a med affairs company, and it utilizes contemporary technology platforms for building and sustaining relationships amongst healthcare providers and of different disciplines and things like that. And it really is kind of an innovative way to engage with a new audience. And so, really leveraging the tools of the trade and learning about them and doing the most with them has been really successful for me.
Could you give us an example of a risk you took to take your career kind of forward in a way that you really had to think about, in a way that others may not have done?
I have had the good fortune of being in a position here recently where, in companies in particular, I've joined a few organizations that were very high risk types of organizations, meaning that the work that they were doing, had it worked out, would have been immensely successful, very fulfilling, and probably also very financially rewarding. However, they didn't work out, and so but you learn in those processes. Even in the failures, you learn. And so an example of this is I took a position with a company that probably had about a 90% chance of failure based on the kind of work and the therapeutic area that they were working in. And however, that 10%, if that 10% would have blossomed and we would have hit the endpoint that we needed to hit to commercialize the drug, that 10% would have been the most fulfilling experience in my career. The satisfaction that would have come from that achievement in succeeding in bringing a new therapy to a patient population of high unmet medical need, it was worth the risk.
If you could go back and change anything in your career, what would you change and why?
Probably the one that I would have changed was around, and again, it goes back to risk, it was around leaving the pharmaceutical industry and starting my own consulting firm and business. So this is back in 2007, and it was in a position where, again, I felt I could take that risk, I could start something new, and it was the timing was right to do it. What I would have changed is doing my homework a little bit more thoroughly to prepare for that experience and really understand from others who have gone through that transition from, employee to entrepreneur to business owner, and really understand what that meant. I didn't have a great appreciation of it when I launched into my business. And I had to learn on the run, and it made it for a much more difficult process. The success that I had with that venture was limited by the lack of experience that I didn't get before going into it. I learned a lot, and that's, looking back on it, and based on what I just said, had I taken an extra 6 months and met with people who had gone through this process and really understand the steps that they have to take to be able to be successful, that would have been a wise investment in time and patience to get that information.
A lot of medical science liaisons are always asking me the question, where do I go with my career path once I'm done, or once I want to move forward, I should say, with being a medical science liaison? Did you take that career choice because you were thinking, okay, well, I've done this much in my career, where do I go from here? Where's my kind of promotion? Where do I move forward? Or was it just because of the passion of wanting to do your own business?
To your question of what was the impetus for me to do it, was really around the idea of being a business owner and the challenge of taking that really big step in becoming a business owner. And you sleep or lay awake at night thinking about the potential of taking this step, and it builds to the next step, and builds to the next step, and it can take you in some really great places. And that was it for me. I mean, the experience that I had as an MSL really led me to be able to be well-rounded and enough so that I felt like I could leverage that experience to the venture. And frankly, there were moments where it was quite successful, and it really did work out. As a medical science liaison, a couple of things that I would mention there in terms of what comes next after being an MSL.
Yeah, please do. Yeah.
And frankly, I would like to share with folks that don't think it's green, the grass is greener on the other side. I think there is a natural instinct that you want to take that position, take that experience, and take it internally into a company like where I am now with Halozyme, and apply those experiences to grow your career. And in many cases, you do have to take that path, to be able to grow your career. But I will caution people, especially those who really like the role of an MSL, the engagement with the thought leader community and the investigators, and just that whole exchange of science principles with folks, it really is a great job. And when you come inside and you lose that, if you love doing it and you lose that component of it, you may not be very happy.
What is the number one thing that you see that is holding other people back from being successful who do the job that you do?
I think that there's a long history, again, in the med affairs function of kind of a tried and true process of letting the science dictate the role, and the Puritan approach of we only speak on science. We're not selling anything. We're not selling a product, my integrity has to be grounded in pure and indisputable fact. And that in a way is true. I mean, we have to be grounded in science, and we have to be grounded in evidence that is factual, that can be defended and whatnot. However, as a function and as an individual, we're all selling something, and we have to recognize that we're selling something. And in med affairs roles, what you are selling is a philosophy. You're selling a company direction. You're selling a potential benefit to humankind in terms of new drug entities or whatever you're bringing to the marketplace or trying to bring to the marketplace. So don't be naive and think that your role is just to be a fact generator or a fact deliverer. You really do have to think about it as a job that you're trying to sell a concept. You're trying to influence and change people's minds. And that's okay. That's what we should be doing. And I've seen people who've taken the alternative approach, and it's very limiting in terms of yes, I mean, maybe your personal integrity is preserved and you feel good about yourself, but you're not doing a service to the greater the greater good, because the information that you have isn't being shared where it needs to be shared for the benefit of the company, of mankind.
You're a really big believer in mentorships. Can you give us a bit about why you're such a believer of this?
I'm a believer of it because I've seen it actually work, and it really was introduced to me by someone who was seeking a mentor, out of the kind of out of the blue, and with the utilization of new technologies like LinkedIn and whatnot. A young aspiring professional reached out to me on LinkedIn and introduced herself and said, listen, I want to, I've looked at your career, I've looked at your history, and I'd like to understand how I can become an MSL. I like that role, but I'm having trouble breaking in. And so we had a conversation, and it eventually led to an opportunity where we met, and it's a relationship now 7 years old, where I continue to have, 3 or 4 times a year we talk and provide some guidance, and I actually learn a lot from her these days, because I've seen her career follow a nice path where she has been able to to take the guidance and get the experience and take the next step and the next step and the next step. And it's been really satisfying to watch that, and I can learn from her, because I can then come back to her and say, how did that work out? Was my advice was it good? Did it work? Did it not work? And so it's been really satisfying to see instances like that where people have been able to grow.
Going back to your the MSL that you mentored, was there anything over their career where whether it was your advice or through their own discovery, that you really saw was a real kind of game changer for their career, a real eureka moment, something that really took them from a good MSL to a brilliant one?
Yeah, there was actually, in this particular case, is when she got fired.
Okay.
So it was traumatic for her.
Yeah,
it was
of course,
traumatic for me to watch that play out, because she was again using some of my guidance and advice, but it gets back to really assessing your risk profile at that moment to determine if I should take that risk. And this was an individual who I think miscalculated a little bit on where she was in her career, in terms of how influential her experience was going to be for being able to take that next step. And she got arrogant. And that arrogance led to her, actually being removed from her role. And so that setback grounded her in the ideas of, kind of marching through at the pace that you should march through, and making sure you have your backup plan before you take the risk. It took about 4 months, but she was able to, get back into the employment ranks of the employed, got back into an MSL role, and from there was much more strategic in her thinking about how to navigate, and has done quite brilliantly since then, in terms of growing her career, making changes at the right time that enabled her to be successful, versus trying to go too fast or trying to be too aggressive, too arrogant.
What is the final piece of advice that you'd give to anyone who's watching this video today?
For me, I think it is important that you do take risks at different times in your career, but it's so important to know what your risk profile is at those different times, and really actively understand that risk profile and apply it, because you don't want to be taking big risks when you don't have a fallback position or a buffer zone that, should the risk lead you down an unfortunate path, you have to be able to recover from that, and do so without compromising your family or your lifestyle and things like that. So really understanding your risk profile as it applies to your career, I can't overemphasize how important that is.
Okay, Blake, that brings us to the end of the episode. I want to thank you so much for being a guest on Inspiring Careers. It's been an absolute pleasure having you on. Blake, I've got a feeling that there's going to be people watching this who will want to ask questions, who are going to want to get in touch, especially probably about mentorship, as you described that so brilliantly at the start of the show. If anyone wants to ask you a question, is it okay for them to send you a message or connect with you on LinkedIn? Would that be all right?
Yes, that would be perfectly fine.
Cool. Brilliant. Well, if you have any questions for Blake, likewise, you can ping them to myself or get in touch with him on LinkedIn. Thank you so much for watching Inspiring Careers. Please do like, share, subscribe, and comment on the video below. And I'll see you on the next episode. Thank you again, Blake. Take care.
Thank you very much, Dan.